Hi.
Hi. Where's your mug, Dr. Kelsey?
Well,
Cheers.
I think it's at home.
Oh, dear.
You're
Well,
gonna ask me.
welcome to Coffee and Childbirth.
And water.
And, well, it is.
But I
usually.
did, yeah. I did have coffee.
One of these days, I think we're going to do a morning recording and actually have coffee in our mug.
I think we will, yeah.
One of these days.
I can see that for us.
Yeah. So, welcome to our new episode.
Mm-hmm.
So today, I'm Dr. Rhee. This is awful.
This is okay. We're doing it. We're here.
I'm Dr. Rhee. I'm a chiropractor for women and children.
Yes.
And
I'm Dr. Kelsey. I'm a physical therapist by trade, and I see moms and babies in their homes.
I love yours much better. I just go Dr. Rhee.
Well,
I should have a saying. Maybe I should have a saying.
You have your.
Yeah, we're women and children.
When you say it like that, it's.
I mean, I love it. It's a new thing. I need to own it more. I need to own it more. I like it.
So I also started saying I'm a physical therapist this has probably been for like a year, but I started saying that because when I say I'm a physical therapist, people already have an idea of what they think of physical therapist.
And it's the same for chiropractors.
And it's like,
car accident?
I'm not that actually. So I just say I'm licensed. That's what my trade is. Yes. But how we do all of that is very different.
I like it.
But yeah, our topic today, speaking of things that like people don't know.
Yes.
And people, word association.
Yes.
The things we were going to talk about are the Webster Technique.
Webster Technique.
Which is definitely your area of expertise.
Yes, ma'am.
And then I, as an outsider for that technique, Bradley gets floated around. The Bradley method gets floated around a lot. Like we said, Webster. Is there another one? There's not really. I guess maybe Lamaze.
Lamaze is another word that gets thrown around a lot in the birth world. And Maples, are you okay? Are we doing a funny paw thing again?
Yeah.
Okay.
And those are all prenatal.
Yeah. Correct.
Right?
Yeah.
So Webster doesn't, correct me if I'm wrong, Webster doesn't necessarily go into postpartum.
No.
Okay. So that helps in my brain as a consumer and someone referring is those are all prenatal techniques, supports, methods that are helpful to improve the outcomes of birth. I mean, I think that's probably generic as far as like what is the outcome that you want.
I think you said it perfectly.
But we're trying to make that easier, whatever easier means.
Well,
tell me what Webster is. How would you explain?
Developed by Dr. Webster, because of course, as doctors, we like to name things after ourselves.
Yeah.
I don't have one yet.
We want the credit.
I don't have anything yet. But so Dr. Webster, a chiropractor by trade, he saw that there was this need for pregnant women because our bellies just become a totally different shape and right. And he said, how do we support the growing belly during pregnancy? And obviously, as a pregnant mom, you can come in, get adjusted, of course, and the way I explain it to people who are inquiring about it, I say, well, a chiropractic adjustment deals with the hardware of the body,
which would be like the spinal segment or those segments working, the bones,
right? The bone, the skeletal system, right? And the joints, right? And which, in fact, will affect the the nervous system,
right?
But a growing belly, it's growing so fast, right, that it's really difficult for our body sometimes to like figure out how it's actually affecting the alignment of the whole body as the gravity starts, the center of gravity starts changing. So the Webster technique was developed to bring balance to the soft tissues of the pelvic floor and the belly. So a chiropractic adjustment will bring balance to tissue, which is the hardware tissue, which is the bones, right, or the skeletal system. And then the Webster technique, it's actually a supplemental technique to the chiropractic adjustments, and that will bring balance to the soft tissue.
Okay. So can I ask a demonstration for that little piece?
Sure.
So if we're thinking about if this piece of paper, so the back where the spine lives and all of that, like you were saying, that's hardware. That's what the adjustment, like you were saying, just the regular adjustment that you would get as a chiropractor. That's what we're looking at. But you're saying the front, where the fascia is, where the belly is, where the belly muscles, where the baby is, and then underneath that part is where Webster is like focusing.
So very specifically, it centers around the round ligament.
Gotcha. Okay. So round ligament being low. So technically it's like lower, or yes. So for people, if they're not sure what that is, it's like lower in the belly on the side, or kind of in that. Gotcha. Right. So soft tissue being that area that he's saying, okay, we need to support this because the rate, how fast it's growing.
I wonder if that picture can be seen. You know what? Let me see if
this is a fun little, okay, guys, this is fun.
I'm getting up.
We're disrupting the fourth wall. Is that what that is? Where it's
I think so.
They go behind the camera.
Watch me break this.
Well, at least you do it and I don't do
it. Okay.
Because it's your picture.
Okay. So that just means I buy another frame.
Sure.
Okay. So this would be a great illustration of what's happening. So obviously this is a very simplified illustration of it, but this is the spine, as we can see. So we want to bring balance to the spine. So alignment segmentally will bring those nerve tissues to respond to the reproductive organs properly. Right. As our hormones are changing, and it's going to start changing the integrity of the ligaments and the tendons and all of that stuff too. But as the babies, the uterus is starting to enlarge and get bigger and bigger and bigger, that round ligament is going to get really stretched out. Whereas before pregnancy, I mean, you can't even feel those, right? And even during pregnancy,
it's not like a band.
It's not a band. It's not like, oh, there it is. It's not that, but it's an integrity of feeling when I'm able to actually locate it and I tug at it, the quality of that tug is different than when I'm actually on the ligament versus when I'm off the ligament.
Yeah.
And I'm tugging at it.
The amount of feedback from
yes. Like, well, the patient's gonna be like,
the patient's
oh, I feel that.
Yeah. They're really gonna help guide
because
along.
It's attached, it's anchored into the pelvic floor or the pelvis, I should say, the bone tissue. Because I think people don't realize is that all the soft tissue anchors somewhere.
It has to be connected.
Correct. And it's gonna anchor into some sort of hard tissue first. It's like the carpentry of the house. Right. So that skeletal system is where it's going to be anchored into, which is also the pelvic floor or the pelvis itself. And so as a Webster, you have to always make sure that the sacrum is in the best alignment possible, because that will determine the rest of the foundation of the pelvis. And then the ligament itself, when needed, this needs to be also addressed, and that's the Webster part.
Gotcha.
So we have two also. Right.
Because previously, before Dr. Webster created the technique, like you said, it was more specific to, okay, we're doing this in hopes that
the nerves
everything is cool and we're good.
Right. But we know how hard it is. I mean, to carry that weight,
because of the like you were saying, the rate of growth. It's hard because pictures. That's why the videos are so great and helpful.
Right.
But like you were saying, the rate at which it has to expand this is giant. You have to remember how quickly and how fast that expansion happens, and everyone's tissue, this type of tissue that's connected, like everyone has a different level of, does that stretch a lot? Does that not stretch at all? Does it stretch too much and we don't necessarily feel it there, but we feel it somewhere else? Like, that's the other interesting part, like the challenging, funny part of it. Okay, got it. So Webster's saying, let's put these two things together, because he probably obviously gets better results for moms. He gets better client acquisition and they're staying longer and all those things. Like, the system is working. And then, is there anything else you want to say about
so I think Dr. Webster was basically saying, let's work it from the front, work it from the back, but also work it from the front. Now, I think the big part also to understand is I incorporate a little bit more of the pelvic floor work as well. So I work on the hip flexors a lot during it. And then also I will work on all the soft tissues that are sitting on that pubic joint region. And then the last thing that I do is I work on the ligament. Now, not everybody who's pregnant will need or require Webster.
Correct.
Okay. I do check for imbalances once a week after the week of 20.
Interesting.
Yeah.
Because you feel like the rate of that, like baby is bigger at that point?
Yeah, at that point, you're definitely really stretching that out.
Yeah.
So by halfway through pregnancy, I go, okay, it's time for us to start working on the soft tissues.
Yeah.
Prior to that, you can't even feel the ligaments anyways.
Yeah.
So about week 20 is when I usually start feeling that, okay, that integrity of tugging, that sensation, and the moms will give me some feedback on it. They'll be like, oh, yep, I felt that. And then when I move away a little bit, they're like, no, I don't feel any pull or pressure or anything like that. Yeah. But when I'm able to find that ligament, that really makes a big difference in regards to how they're carrying that weight as they're growing.
Definitely. Do you want to go back to mom?
Would you like to come back?
She's like, this is weird. This is not how any of this works. So okay, got it.
Yeah.
So that was a helpful visualization for that.
Oh, good.
That's a combination of why chiropractors will go into utilizing that method probably is because they notice, especially if they're working with someone more often in that population. Yeah. Like that's a majority of your population. So you're going to invest in utilizing those techniques.
Maybe I should also mention not every Webster-certified chiropractor will practice Webster with the same mindset, I feel like.
Interesting.
So most of them are probably will say, oh, it's kind of to like turn the baby into better position.
Got it.
So that's what I hear a lot.
Got it.
Right?
As far as someone who's using it as a specific tool for that outcome.
Yeah.
Versus you're integrating it into
their daily, like their weekly visit, right? And so most chiropractors will probably use it as a tool to turn babies.
Okay.
Or I should reword that. Not turn babies, but that's how they market themselves.
Well,
too.
That's a whole other interesting
sidebar
we can
help turn the baby around.
Because that is what that is what you want as a mom who has a breech position or a transverse.
So it's highly associated with breeching. So when patients will call at 37 weeks, 38 weeks, and they're like, I just was told that I'm breached.
Yeah.
Can I come in like now?
Yeah.
And I was like,
So is that, since you probably know this, answer this question, is that what, do you think that's what Dr. Webster intended?
I don't think so.
Okay.
Yeah. I mean,
because we always bastardize things as we like bring them over time.
Right. Over time. So I got to learn it from two different doctors with two different mindsets.
Oh, interesting.
So when I first was certified, I learned it through, maybe I shouldn't say the names. I'm not going to say the name.
Yeah.
So I'm going to say Dr. A. And Dr. A and Dr. B were partners.
Okay.
And they both learned it from Dr. Webster.
Okay.
Dr. A decided
this
to
seems
do
like
the
it's
marketing.
A story, but it's not. It's real life.
It's a real life thing.
Okay, good.
This happened. So me as a student, we're like, la la la, I want to learn. And so Dr. A and Dr. B were partners. Dr. A decided that she wanted to make it into a big thing and teach it to the world.
Okay.
So there was a lot of marketing thing that was happening, and there were certain things that were said that probably got misconstrued over time that turned into this, oh, if you're breached, you need Webster.
Yeah. Because we also will simplify as humans. We're going to,
over time,
we're going to just take what we need from something.
Yeah.
Okay.
So, and I think she did try to correct that mindset.
Okay.
But it just was like out of hand.
It was, the train had left the station.
Yes, correct.
We were like, we would love for that to happen, please.
And she wasn't my favorite person either. But anyway, but I got certified through her program, which is a really big program now.
Okay.
So I took it over 20 years ago, and they were still small programs.
Sure.
The programs are very different than it is now.
Okay. And then Dr. B.
And Dr. B, who is my over the years, I got to learn from her.
Okay.
She's also a Gonstead doctor.
Okay.
And she also learned it from, obviously was a direct student of
Correct.
Dr. Webster.
Yeah.
Again, they were partners. She ended up leaving that organization because she did not agree with some of the methods and the way it was going. And so she started her own organization back in the days.
Yeah.
And now she teaches thousands and thousands of people. And she uses the Webster. And when I took her course separately, even though I was taking this is how I met both of those two doctors back in the day, because they were partners. When she reorganized the way that she wanted the curriculum to go, it made way more sense when I took her course, Dr. B's course again. And I go, because I was always struggling to learn it. Like, I've done lots of, I've done a lot.
You have gone through all of the credentialing and licensing and all of the degrees that you need.
The funny thing is, when I had my old office, I had a second room, and that was like my shrine. This is Dr. Rhee, the old Dr. Rhee, who was very full of herself at times. So I had a whole second room that was like filled. There was a whole wall of my credentials of what I've done, my work. Because I wanted people to know I'm very well certified in what I'm doing, right? And I've done my studies. So, and I don't want to say I'm an ego, whatever, but it was just like something but
that's also the only thing we have to stand on when we start out.
So I'm like, look at, I've done my work.
In school of like, this is that's why you pay me all this money to get certified.
Correct. Like more certification, more diplomas, the better. Sidebar. Sorry. So anyway, so I did that. And then I did it with Dr. B. And with Dr. B, when she had it organized and the way she taught it, it just, my success rate with using Webster way skyrocketed in my practice. Because I was just like, always like, is this right? Is this not right? Like, am I feeling it right? Is this the right direction? I was like always struggling with it. And so when I was doing Webster, right? And so then when I started implementing and having a better understanding of what the actual point of Webster is, and the way Dr. B taught it, she just, I don't know, just the way my patients were during pregnancy and how comfortable they were throughout the pregnancy. And if there was a breaching situation, we were able to get that resolved fairly quickly. My success rate definitely gone up after that. So
interesting.
So the way I explain it to patients is I tell them, we're not trying to turn babies. What we're trying to do is bring as much balance and symmetry of the pelvic floor and the belly so that the baby can do its own turning. And that's it. That's what it came down to. So I love working on patients with Webster. I also get to learn the baby's personality while they're in there. I love that. That's always fun.
So that is an interesting, I mean, even within its own teaching of that chiropractic technique, it's different. It's, explained differently. I agree with you on like really at that 37, 36 weeks. There's a lot of like, don't worry with breech position, like don't worry before that. But then also you have now way less time to support movement of the baby if you're waiting until that ends. So it's kind of like, oh, don't worry about the tire that's deflating slowly and you have a slow leak in your tire. Just wait until now you have the light on in your car that's telling you to get it replaced. You only have 30 minutes to get it replaced.
Like do it now.
That's what it feels like.
Right.
So it's interesting that's a better way, because I thought for a long time, I thought it was like,
because you thought it was something else, right? When you first asked me
I knew
about
it had to do with prenatal care.
Okay.
Because there was a lot of like that talk. Like I would see clients and then they'd say, oh yeah, I'm seeing a Webster-based chiropractor, whatever. And I didn't really, I was like, okay, what's this? Like, what is this thing? But I didn't go into it. And then I think one time I did look it up, like I Googled Webster Technique, because I was thinking like, well, what is this? Like, is this a method that I can take? Can I take a continuing education course on this method? And then it was for chiropractors specifically. So I was like, interesting. But what I have found over time is spinning babies, which was created by a midwife, I believe.
I believe it's a midwife. Yeah.
In my opinion, after looking at them and like talking with you about what you just said of like round ligament, putting that soft tissue piece together, I feel like spinning babies is similar in the realm of what a PT can do to what you're doing there. So it's not the same, but we also have different, because I'm looking at pelvic floor symmetry with an internal exam, abdominal symmetry. So same kind of thing of like, we're trying to open up, like you said, I'm very careful about like, we're just trying to give them an open path. Not physically move them. Like
we're not like
shoving them down, rotating around. Like I can't do that. So it's helpful to know like, okay, that is the tools. Those are the tools that are helpful for your like for your session. And then these are the tools that are helpful for my session with the same intent. And someone who is receiving that care is going to have the best outcomes because they're having both sides of the, like both sides of like with your picture of the L, of where it's like, you're looking at that spinal part and then kind of towards that round ligament. And I'm looking at like the abdominal and soft tissue part and into that pelvic floor, right? Floor, so it's like kind of this nice, we have the whole landscape
like all covered.
All covered. Like wrapped around. High five to us. High five to us. So, you know, that's an easier way now to explain like what people are looking for. I 1000% agree with you that 37-week call or that 37-week conversation is never...
It's so tough.
Comfortable. Because I'm always like, I'm not a miracle worker. But
I wish I was. But
I mean, then we would be God. So I guess
we would have lines out the door. Like, we would not. I mean,
we would be selling our soul to the devil at that point, I think. But yeah, it's an interesting. So that is very clarifying on like what Webster
that's good.
does. I'm glad. And then just for like a little bit of the distinction, Bradley method. What do you know about the Bradley method? I can share what little I know about the Bradley method.
I know very little myself. So
the Bradley method that I've seen from clients, I am awful and I've never done any of these things when I was pregnant. So story for another day.
I was never pregnant, so that's my excuse.
I just didn't do them. But when I've seen clients do them and like them, be really involved. Bradley method is like they're talking about the breathing. They're also talking a lot about like nutrition, dietary, like higher protein, higher fats. That
part I did not know. Okay.
Yeah. So there was more that I didn't realize as I've had clients do that, of that piece of it.
Okay.
What else did they talk about? There is some like strength, movement kind of
like positioning,
positioning, that kind of piece of it. I think the biggest difference was, or one time I had a client explain like the way that they talk about breathing is J breathing, which was formulated by the Air Force for people in the armed forces, or like Marines, or like, you know, some of that high intensity stress pressure environment. I think Bradley must have been, I don't think Bradley's a medical, we'll find this out, but I don't think Bradley's like a physician. Maybe they were a physician, but I think they were involved in like the military or something. So it's techniques that were for high stress situations, which makes sense if we think about like, it's just a stressful situation. That was interesting.
I mean, there's a huge correlation of like how we breathe. And how we can actually self-regulate the stress hormones from kicking in. So there's breathing
which
technique.
Is why the Lamaze
is a
part
big
of
one.
Like that being specific. I don't know if those classes have changed over the years, because again, I took like 2 childbirth in the hospital.
You're
classes.
Just a natural birther.
I guess. No more for me. I'm good. But yeah, I'm just a natural birther. But those, I should look it up again because I'm curious about.
I'm curious too because it's been a while. There was a big, huge group that I'm just blanking on her name right now, but she was around. She was a midwife, or she probably still is. I don't know. It's been a while, but hopefully she's still with us on this earth. I've been around long enough that I've realized there are people.
I haven't looked at their website in a while.
They're passing away now, but as we talked about, my my family. Anyway, so she was a really well-known midwife in LA.
Okay.
And again, I'm just blanking on her name, but she had this huge Bradley method class.
Yeah.
And she did invite me a couple times to come. And did I go? No, because I'm like, I'm so busy. I don't want to sit through a class.
That's here where I think I've seen it the most. I didn't see it a ton in Seattle. I'm sure it was there. I didn't necessarily, but I feel like I've heard it a lot here in like the crunchier mom groups and people who are seeing midwives, not associated with a hospital midwife, but like a full home birth midwife. Like that's where I think I've seen most moms. So it makes
same
sense.
in LA as well.
It would make sense that
we call them granola moms. In LA.
And it seems like there's a good community. What I feel like I do notice with that is like the people who are doing that method are like they're in community with each other talking about it, which I think is powerful. Versus like a Webster is specific to a practitioner, or spinning babies is more specific to a practitioner, person associated with it. So
I recommend. I also going back to the breathing part. So I always kind of associated Lamaze versus Bradley method. That's how I've always kind of associated when I hear moms talking about it or the providers talking about it. It sounded like it was a technique for position and breathing. That's how I've always kind of categorized it. So it's like, oh, am I doing the Lamaze class or am I doing a Bradley class? That's kind of how I associated those two.
Yeah, and I think I'd have to look again, which this might be an easy just chat GPT question, honestly. And give you like the comparison of these two things together.
Which maybe we can do afterwards.
Which we could do as like a conversation. But
another thing,
I don't know if Lamaze has nutrition. That was what surprised me about the Bradley method of like, oh, I didn't realize it was
I didn't know about the nutrition
all of these
part.
Things.
So yeah. The other thing that I got a lot in LA was hypnobirthing.
Oh yeah.
That's another big one.
Yeah. I
excited.
feel like that's a section, a show in of itself. Okay. So that was another one that I feel like I've heard.
So Lamaze,
secondary to
hypnobirthing.
Webster.
Okay.
Is like usually I hear a lot about Webster. There's a lot of like talk about that method or technique, and then the second most is hypnobirthing. Also because I think I know the teachers of hypnobirthing here, so I feel like that happens in conversation.
That was a huge trend. Like 15 years ago in LA.
Here.
So it's kind of like it trended out in LA.
Interesting.
It wasn't. So I feel like now that I live here,
and
I
Vegas
feel like
is like we're 10
to 15 years back. So now that I live here, I'm noticing what was really popular like 10, 15 years ago in LA.
Yes.
It's very popular now. So I feel like I have an advantage.
Yeah.
Because I lived through it.
So what's the thing? Do you feel like, okay, so we have like a minute or so. Yeah. What do you feel like with hypnobirthing? Because I'm in the current wave as far as like I only learned about it when I came here from Seattle. Like
which
we didn't
part, the
really
Webster or hypnobirthing?
Like I didn't really know about it then. I feel like I heard it a lot more
when you were here. I see.
So what do you feel like seeing it peak in popularity and then like fizzle out? What do you feel like is one thing that you would take away from that?
Well, it has to work on you.
Sure.
So
like anything.
That's the reason that's the reason why it fizzled out, I think, in LA, because not everybody can be hypnotized.
But do you really? I don't think people are being hypnotized.
It is a whole class. You take a whole class with like the hypnotherapy type of like thing, right?
Yeah.
And there is this hypnotic thing that they do, and they tap into your brain so that when you get into this like birthing situation where it's like extremely painful, right?
Isn't that just visualization? Isn't that just like
no, my friend,
you're going into a flow state and you're figuring out your flow state for you?
Hypnobirthing in LA was a hypnotherapist that will hypnotize you and figure out how to tap you out of pain mode during birthing.
Okay,
and then
we need
that
to get a hypnotherapist in Vegas on the show.
We should,
because I feel like when I see them have, like when I see the person going through hypnobirthing class and techniques, their book that I've looked at, that they're like, yeah, we do this like once a week, we go to class or whatever.
Yep. It's a self-induced hypnosis.
It does not look like that. Like I'm honestly like, okay, these positions are not rocket science. Like maybe I should not say this.
Well,
take that out.
Well, the way things were back then, and that's how so again, maybe it evolved by time. Now it's here. But back then, it was the series of classes that the moms would take so that they would learn how to self-hypnotize during birth. So you're tapping out of that painful state of being.
Sure.
And then the hypnobirthing therapist would be there to guide you through that process when you're taking those classes. Right?
Yeah.
So that's how it was 15, 20 years ago when it was really popular in LA.
Because most of the people who are doing the instructing, doing those classes are doulas, or
so it has changed.
Does that make sense? So they're not like a psychiatrist. They're not like a psychotherapist. They're not like.
But I don't think hypnotherapists are either, though.
Yeah, but I guess I'm thinking like they don't do that. They're not like, I'm a hypnotherapist first, and then I'm seeing pregnant people. They're like, I'm a doula first, and I'm seeing
not
these
how it
pregnant
was
people.
in LA.
So that's interesting.
Yeah, it was usually a hypnotherapist back then, and teaching moms how to get into that state of being.
Sure, like you said,
so that you're not. Yeah, so I wonder how that.
If you're not receptive to it, then that's not as
So that's
easy
why
of
it fizzled out a lot of times in LA, and people stopped talking about it for a long time.
Interesting.
So I wonder how that transitioned.
Yeah.
Into what it is. I don't know anything about
rebranding of the marketing of that.
Yeah.
I also feel like there's a strong faith component in those not in the hypnobirthing classes as well, which is also interesting to me. So it's like that also would be interesting if that, because that doesn't sound like a hypnotherapist. You know what I mean? Like that does not sound like a hypnotherapist vibe. Like a doula who is faith-based does not sound like those two people are not
going to be coming together.
Like coming together. I'm not.
Yeah, no, that's not how it was back then. So but then
new topic unlocked.
Yeah. So then it's like, what happened since then and now? Like, so I've been doing this long enough that now I'm like, wow, like I'm seeing the changes happen.
Maybe I'm misinterpreting what their like marketing is, but I feel pretty confident because I knew I've met them in person.
Yeah, and you saw the material you said.
Yeah, right? I saw the material and I know the instructors. Yeah. And so I'm like, things change.
Things are wild. And that was 15 years ago. So for me, but
that is another method, yes, that people talk about as far as like managing the pain. That's probably more specific to the birth experience itself. They're not doing so well managing whatever the pain is that they have at 25 weeks in their hip, whatever. But
right.
Okay, well, that was very interesting. That was a good.
So we talked about Webster
And Bradley. Those were the big ones. We have outstanding questions on everything else. Lamaze,
right? Hypnobirthing. Yeah. And a little bit of Bradley too.
And a little bit of Bradley.
Yeah, Bradley, we need to learn more.
Those kind of top three of like what they're.
But just to wrap, are we wrapping up? So wrapping up, I guess Webster, I do get a lot of calls asking for Webster, but a lot of people are like, don't have any understanding. Those people who are asking for it, they don't know what it is.
Right. And also potentially it's been marketed, even if they're not really knowing what it is, it's marketed as this is the flip your baby technique.
Yes.
So it's almost like, can we move away from it's the flip your baby technique and just say this is just part of helpful comprehensive care?
Yeah.
Just like when people ask me, are you spinning babies certified? Right. It's like, it's not to help you flip the baby. It's just, let's talk about why it's helpful in general for you to get on your path.
There's, what's that technique where OBs do when they're fit? Yes.
External cephalic version.
Yes.
Some people are really, that would be another one. Interesting.
That's another, maybe next topic.
Some people are like terrified of that.
Yes. I've had a few OBs that I can think of, top of my head, in LA that were like, I hate doing it.
Interesting.
And then I've had,
because it's like a high risk.
Well, it's high risk. Okay. It's definitely high risk, but also they don't feel right. They said doing it, like they don't feel like it's the right thing. Like like it's very forceful. Like it's like it's really, really forceful, right? And then I've had, I would say there was one OB that I didn't know her very like in person. No, I'm sorry, it was a man. I didn't know him that well. I knew of him through my patients. He was like the only one that seemed to have really great success rate with it. And so it's still a very hands-on technique. So I feel like he was like the only one that I've had interaction or like had mutual patients that they were like, we're going to do it. And I was like, okay, good luck. And then it was fine. It was everything great. But then I've had other OBs where like, so I think it's just like, if you go in with it.
Yes. I was just
like
going to say that.
Totally confident. Like I know what I'm doing. Same thing with Webster.
Sure.
When I was unsure.
Sure.
The first freaking 5-7 years of doing Webster.
You got to believe the technique is going to work. You got to believe
that
you can do it.
Exactly.
You can't hesitate when you're halfway through the adjustment or halfway through the manipulation.
Then
in my case,
that
it's like, I don't know, because you're just going to back off.
It's not going to work.
You have to like do it.
Yeah. I really enjoyed this conversation, by the way.
Thank you. Yeah, it has helped check a lot of boxes. We got some visual. It helps me be like, okay, that's what she's talking about.
Yeah.
I need to see something.
Yeah.
I think those are some good like techniques and topics, because we do hear that a lot.
Yes.
Of the question of like, do you do this? Does it help?
Do people ask you if you do Webster then?
No.
As a physical
They
therapist?
ask if I know of a chiropractor who does Webster.
Okay.
They more often ask if I do spinning babies.
Yes.
Or in general, if I help with breech positioning. They'll ask if I help with breech
babies
positioning.
also has changed a lot over the years.
Yeah. I feel like I didn't necessarily know. When it was starting, I was like really, I don't even know if I was in PT school. I don't remember. I'd have to look at the dates on that. But it definitely, I think, similar to kind of the marketing conversation you were having.
Yeah.
What are they saying? I think it's gotten better.
Uh-huh.
I think it's gotten more clear.
They've been more clear, but also more exclusive. Because when they started out and I started recommending it, all of their information was free. 100%.
Oh,
it was
yes.
open.
Oh,
and I was able to look at it and go, oh, I see. Okay, I felt good about recommending it.
Yeah.
Now I can't see anything.
Yeah. It's like behind a paywall.
Yes, you got to pay for sure.
Which I think they've, just like,
I
people
get
probably taking over from the person who originally did it. They were probably like, oh, this is like, you need to make people pay for this.
Yes, this is information that is like, it takes work and time, and we all know that.
Yeah. So that was a good conversation. Some other things that we'll talk about again, and maybe we'll settle the hypnobirthing. Now I'm like, we're gonna settle the hypnobirthing.
Well, I want to chat you.
Instagram. Do you get hypnotized in? Because I always tell people no. I always tell people no. I say you're looking at your personal flow state and you're getting into your flow state. But I could see how some people would be like, well, that sounds like hypnotism to me. Yeah. And I'm like, that's just meditating. Yeah. Or that's just using your own tools for yourself. So, but I always say no, because people are scared. And I'm like, I don't think you're going in and like sitting in a chair and they're like, ta-da.
Yeah, right. No, that wasn't the case either back then. Yeah. I do remember this one, like it's coming back to me. There was one patient of mine, she wanted to do water birth. And then she did the hypnotherapy. I'm sorry, hypno birthing in water for all of that thing. I wasn't there for the birth, but she wanted to do water birth because water birth was trending like crazy in LA at that time as well.
LA. Full send on the trend.
I mean,
what?
Well, I had a great conversation.
All right.
Thank you so much. And you don't have your mug, so we're just gonna. We'll still cheers.
We'll cheers for the editing.
Thanks for joining us.